Good morning, everyone. And in this lecture, we are going to talk about pulmonary rehabilitation. Now, pulmonary rehabilitation, there is a lot of pulmonary conditions which can be benefited by rehabilitation programs. But in this lecture, we will focus more on COPD, which is chronic obstructive pulmonary disease. Okay, so if you will see over here, for example, someone have any disease like cystic fibrosis, restrictive lung disease, chronic obstructive pulmonary disease, even asthma, right? So of course, like whenever there is disease, we treat them, but whenever there is impairment, so to to um, avoid, or you can say, or to prolong the time to reach the um, stage of disability or handicap, rehabilitation plays a very important role. Now you can see over here what are the aims of pulmonary rehabilitation whenever anyone are in um, inducted in pulmonary rehabilitation programs. It increases the exercise tolerance and reduce dyspnea. It increases the muscle strength and endurance. It improves the health related quality of life. It increased the dependence in daily functionality. It increased knowledge of lung condition and promotes self-management, and it promotes long-term commitment to exercise. So basically, the aims of pulmonary rehabilitation is to improve the cardiovascular functions, to prevent any complications, and of course, like these are going to benefit the person who else is involved in that. So um, you can see over here what are the essentials of pulmonary rehabilitation. It is exercise training, education, nutritional therapy, psychosocial and behavioral interventions. We should keep on assessing the outcomes, and we should promote, or we should motivate the patient so that they should keep on track or keep on doing that rehabilitation program to get the maximum benefit. Okay, as I told you, we are going to basically mainly focus on chronic obstructive pulmonary disease, though there is a lot of other pulmonary conditions. For example, as I told you, um, there are conditions like restrictive lung disease, there are conditions like asthma, there is emphysema, there is cystic fibrosis. So, of course, like all these things can be there. Some of the, and of course, like when it is restrictive lung disease, it could be due to anything like ankylosing spondylitis, it could be cervical spinal cord injury, for example, if I will connect this lecture with my previous lecture, or it could be any neuromuscular disorder which can lead to pulmonary disabilities. Okay, so now you have done COPD or chronic obstructive pulmonary disease, right? And you know what is this disease? It's a uh, like chronic disease, and whenever the patients they have this thing, of course, their quality of life get decreased. Many of the patients they cannot even walk a little. Many of the patients they are on home oxygen for a long period of time, and simply all these things can be prevented, also can be treated. So also, of course, like there when there is limited airflow, it could not be completely reversible, but it can get better. Okay, so all these things we are going to discuss in this lecture. Okay, so again, this is the epidemic. So actually, I'm not going to talk about COPD, like what is the pathophysiology on all this stuff. Rather, I would like to talk about the rehabilitation things in this one, right, directly. So now, yeah, again, like this is the pathophysiology, what's going on in these patients. Okay, and these are the clinical manifestations. Okay, so I'm just doing it so that you can see and revise, okay, what you have done already. Okay, maybe like you have a lot of information about COPD, and of course we go for investigations. Okay, from laboratory examinations, like one thing which I must talk about here is um, who are the candidates or who are the people in which like who can be benefited from pulmonary rehabilitation. Okay, so remember, any patient who have limitation of exercise, okay, anyone who have compromise of FEV1, which is forced expiratory volume in 1 second, or anyone who have FEV1 over FVC, like which is forced expiratory volume in 1 second divided by forced vital capacity, or we take the ratio. Anyone whose readings are less than 60%, okay, anyone who has restrictive lung disease and they are showing the same results, or anyone who have carbon monoxide diffusion capacity less than 80%, right? So of course, like these are the candidates who are well benefited by pulmonary rehabilitation programs. One thing which we must make sure, that the person should not be a smoker, or the person have already given up smoking. Remember, smoking is the major cause of COPD, and that's the reason that someone who is a smoker, first of all, we must refer them to smoking cessation clinics, and then once they have given up the smoking, then we can induct them, or we can put them in the pulmonary rehabilitation programs, right? Okay, so now one of the thing which basically I would like to mention over here is, you can see over here, these are the different components of pulmonary rehabilitation program: education, general exercise training, breathing training, psychological support, nutritional advice, and outcome assessments. Okay, physiological functional assessment. Now, how we classify the patient, um, if you can see over here, they have written the board score. When I teach COPD, I always talk about board score. Okay, I always talk about the PFTs. Okay, all these things. So of course, like all this evaluation should be done. So what they do, by the way, uh, they see like how much the person can walk or can do exercise. For example, if the person is just normal at rest and they get dyspnea on very exertional exercises, uh, compared to that person who have dyspnea on just going upstairs, compared to that one who have dyspnea just by walking on a floor, a straight floor, or as compared to that one, of course, someone who have dyspnea even at rest. So of course, like each one of those are have different type of exercise capacity, and that's why I told you one of the thing, we always check how much is the exercise capacity of the patient. Okay, I and of course, like someone who is completely bed bound, or you can say house bound, who have even dyspnea at rest, with most of the ADLs. What is like ADLs? Activities of daily life, right? So for example, someone get dyspneic whenever he eat or bath or change his clothes, whatever, right? So all these things should be assessed. Okay, and then of course, like they do a lot of functional assessment, and you can see over here they perform PFTs. As I told you, they check this one, they check the bronchial dilation test. Okay, to distinguish like COPD from bronchial asthma, and this is like the MMRCD dyspnea assessment. C at 0, 1, 2, 3, 4. I was giving this example, right? So C, 0 is I just feel asthma during strenuous exercise. 4 is I must stay at home because of shortness of breath or feel asthma even in like while dressing up, right? So this is the board index, which is like from 0 to 10. So anyhow, like of course you have done these things. What is how board index is calculated? This thing is given over here. Okay, and this one is like the movement function evaluation. They can ask the patient to do a treadmill training or bicycle exercise test, or they do 1 6-minute walk test, right? Just to see like how when the patient can become dyspneic. Okay, so these are the activities of daily life assessment. See again the same thing, level 0, 1, 2, 3, 4, 5, depending on at what level the patient can become breathless. So uh, now you can see over here, um, like respiratory impairment, there is dyspnea during moderate exertion. Then you can see over here physical conditioning, and the last thing is like dyspnea even while performing ADLs. Okay. Um, Now, again, we know what are the muscles of respiration, what is diaphragm, what are the accessory muscles, what are the how abdominal muscles they play a role, and all these things, right? So simply like once they have done all these investigations, once they have done PFTs, they have done all the assessments, then they decide like what kind of like either he is a candidate of this physical rehab, like pulmonary rehabilitation program, okay, or what can be done best for that patient, okay. So now this one is like the principles of rehabilitation. So what they do, like first of all, they evaluate the nutritional status of the patient. They see like they for that they do multiple tests like you can see um, wait. Okay, wait. Okay, yes, I was searching for this. Okay, so what can be done is like we can check their calcium levels, their magnesium levels, their potassium levels in the body, their albumin levels, okay, and all these things. Why? Because someone who have bad nutritional status, like of course, when your nutritional status is not good, it means like your immunity is not good. You are susceptible to get more infections, and also like when someone nutritional status is not good, there is like the repair mechanism of the body, they don't work well like the normal people. They are weak, their respiratory muscles are weak, and all these things are weak. So of course like they evaluate that, okay, and after evaluation of course like they go for the treatment, okay. They treat that. So how the treatment is done for that, or what is the management for that, you can see over here, um, like BMI should be seen if the person is too um, obese. Of course like uh, um, we can ask them to, like we can bring them to the normal weight range, okay. Then of course like uh, we provide them with enough calories, of course, okay, and nutritional supplements should be given with supervised training programs. These things should be done. Energy dense foods can be given, which should be well distributed during the day. There is no evidence of advantage of high fat diet, and patient experience less dyspnea after carbohydrate rich supplement than fat rich supplement, probably due to delayed gastric emptying. Okay, whenever you eat fats, of course, they stay more in your stomach rather than the carbohydrates. And the daily protein intake should be 1.5 milligram per kilogram for positive balance for that patient. Okay, so one of the thing like which they do is like they do the calorie assessment. Okay, and later on like they go for um, other things. For example, they check like okay, they modify the, like they see like what drugs the patient is on, if the patient is can benefited by the change of the drugs, what kind of inhalers the patient is using, either the patient is using any type of steroids, inhaled steroids, or what thing can be done for that. Okay, then they always see like either the patient is dependent on oxygen, like either he's taking any oxygen and things like this. By the way, like there is a lot of benefits of home oxygen in these patients. So then they assess what you can say, uh, like then they do the investigations like x-rays and all these things, all the bloods, okay, just to see like what is the condition of the patient. And later on, like what they do, like basically they start this rehabilitation program. If you can see over here, these are the aims of pulmonary rehabilitation. We talked about that thing before, okay. And nowadays, of course, I think like many of the people now know that the patients, like who are getting COVID and they are getting pulmonary edema, so or pneumonia, they put them on like on their front, which basically um, improves their breathing and things like this. So like that is a treatment, that is not rehabilitation. But I'm just like mentioning this thing like because I remember like in COPD, what they ask the patient is to do some exercises in which like they have to lay down on their front, okay, which basically help these patients to what you can say to drain their secretions, okay. Because like there is a collection of secretions in different parts of the lungs in these patients, and we have to drain them as well, for better results, for better breathing, of course. Okay, so these are the aims which we have already discussed before in the start. And once like these uh, like see increase muscle strength and endurance, increase exercise tolerance, reduce dyspnea, prevent and treat the complications, improve health related quality of life, increase knowledge of lung condition, and promote self management. Okay, so of course, like whenever any rehabilitation program is started, the patient should be in stable condition. Of course, like if the patient is not in stable condition, they must be like in the hospital, or like they must be given medication so that their condition should become um, stable. Okay. These are some methods like physical agent methods, like there is ultra short wave therapy, and decimeter wave therapy, ultraviolet therapies, and all this ones. See, one of the things is airway clearance, which I was like we say or we count it under the heading of postural drainage. Okay, postural drainage can be done by changing the posture of the patient, and postural this drainage can be done by percussion methods. So what they do, like they give the patients chest physiotherapy, like they keep on changing the position of the patient, and they tap their chest so that the secretions should go in the center, and then they can be cleared off. This things can be done, and whenever like we clear their airways from secretions, it promote cough reflex, it reduce and prevent repeated infection, it relieves dyspnea and bronchospasm, and it keeps the airways unobstructed. Um, so uh, we teach them bronchial hygiene techniques, in which we teach them postural drainage, percussion and vibration methods, directed cuff, and like force expiratory techniques. It is called as huff cuff, and all those things, right? This is all to clear the airways from the secretions. And then they teach them some breathing exercises or ways. For example, pursed lip breathing. If you will write this thing in YouTube on Google, you can find like they basically breathe with the lips a little close, so which prevent what you can say the alveoli to collapse. Okay, so whenever like they do pursed lip breathing, it improve ventilation, it releases trapped air in the lungs, keep the airways open longer and decreases the work of breathing, prolong exhalation to slow the breathing rate, improve breathing patterns, relieve shortness of breath, and causes general relaxation. This is the way to do this pursed lip breathing. Then there is diaphragmatic breathing as well. The patient should wear loose clothes. They should sit or lie comfortably. Put one hand on your chest and one on your stomach. Slowly inhale through your nose or through pursed lips to slow down the intake. As you inhale, push your belly, stomach out, and feel your stomach expand with your hand. Of course, like the diaphragm is going down, and that's why it is happening. And then slowly exhale through pursed lips as well, okay, by squeezing your stomach. So of course, like the diaphragm will go up. You can see over here, okay, like to promote diaphragmatic um, breathing. Okay, so of course, like psychological considerations are important in um, all the rehabilitation programs. In all the patients who have chronic diseases, they need psychological support. They need because they are disturbed because of their health, so they do develop a lot of psychosocial issues. So of course that should be addressed. Okay, then what they do, like they basically um, teach the patients, or ask, like they let the patient to do some graded exercises, okay, and see what are their abnormalities and what are the benefits of exercise training. Like you can see, like they have decreased lean body mass. So benefits of exercise training, like increases fat-free mass. So all the things are there, right? In which then what how the exercise training programs they benefit. So uh, of course, like it is a graded type of um, like you can say uh, they start from less strenuous exercises, and with time they keep on increasing the strength, or you can say the duration, just to make them like so that they can be used to that. Okay, so there could be lower extremity exercises, arm exercises, and ventilatory muscle exercises, and endurance or aerobic exercises can be done, or strength or resistance exercises can be done as well. So lower extremity exercises as walking, treadmill, that bicycle which is present in the gyms, stair climbing, and arm exercises could be arm cycle, ergometer, you can see it on Google, or unsupported arm lifting or lifting weights. So all those things can be done. So of course, like we know, like exercise have beneficial effects not just in these patients, like in all the patients, we know. Okay, so now, okay, um, this is all about exercises. Actually, these are like some extra topics I'm putting, so that's why I'm not going in too much detail. Okay, psychotherapy, as I told you, all these patients they need psychosocial support. They teach them relaxation techniques. Okay, there's a lot of relaxation techniques. Okay, which can be done, of course, like depending on the person choices. Meditation can be done, like yoga, for example, is a very good type of exercise which basically relieve these things. Okay, other than that, they keep on checking their outcome, like what is the difference in their physiological function, mental function, and social function during all these programs. So the main thing, in COPD, other than what you can say, this rehabilitation programs, COPD patients, they're like the things which are proven by what you can say the research is, like quitting smoking have the best effect. It prolongs the life. Okay, it decreases mortality. It decreases disease progression. And the second thing, which is very, very, very beneficial in these patients, is home oxygen. When we provide the patient for home oxygen, they have very much best effect. Of course, we provide vaccinations to the patients, so that, like, yearly influenza vaccines, or 5 yearly or 3 yearly pneumococcal and meningococcal, what you can say, uh, uh, vaccines to avoid infections. One thing which was Huff technique, basically, what is Huff technique? It's basically what they teach the patient is to do inhalation, okay, and then do, you can say, short frequent exhalations using abdominal muscles like this, right? So and control the glottis, of course. Okay, so of course, this is a very efficient way of secretions removal, which can be used in these patients. Okay, so this is what they do. Rest, of course, I did not talk about any medications, any home oxygen. You have done that thing. Okay, I told you about diaphragmatic breathing. I told you about pursed lip breathing, and I told you about huffing. One thing is controlled cough. So what they do, uh, like whenever after inhaling, they tell them to hold the breath for few seconds and then contract the abdominal muscles, and then what you can say, like forcefully exhale the air using abdominal muscles. Okay, so this thing can be done. It also promotes secretion removal from the body. So then I told you about the drainage techniques which they use, like postural drainage, or chest physiotherapy can be done, right? Uh, like these things can be used. Um, Other than that, um, of course, like there are specialists, like the rehabilitation specialists tell them, teach them all these techniques, like how to cuff and what is huffing technique and all these things, right? And rest is all exercises. So basically, I'm not going in detail of the exercises. Uh, what you can say, because there's number of exercises. It typically, like basically depends what is the functional capacity of the patient, how much the patient can sustain that. Okay, so depending on that, like they do this thing. So simply whenever they do upper extremity exercises, the patient get a lot of benefits out of that, because it also trains the respiratory muscles which are around the chest, as we know. Okay, uh, one of the things they tell the patient is to note down the time how much they walk each day. For example, each day they have to walk 10 minutes or 15 minutes, and keep on noticing distance, like how much distance they can cover. And rest is like all the exercises which like aerobic exercises, like swimming or bicycling or walking or all these things. And then there is what you can say, anaerobic exercises and all these things, right? So we know all the exercises. So aerobic exercises are, of course, like the best one for these patients. Okay, so that's all about. And yes, one very important point which I forget to tell you is patient education is very important. Tell them about the condition. Tell them about what is the importance of this program. Tell them about what is the importance of vaccinations. Tell them what is the benefits of, for example, leaving smoking, and tell them what are the things which can benefit them the most. Like I told you, home oxygen, and tell them avoid heavy meals, because whenever there is heavy meal, it pushes the diaphragm up. It basically causes difficulty in breathing. And tell them that they must take a healthy, um, more carbohydrate type of diet. Why? Because it digests early. It stays in the stomach for a less period of time, which basically what you can say, uh, does not cause any pressure on the diaphragm. Tell them to wear loose garments or loose clothes. Okay, because whenever you are wearing, for example, if your belt is too much tight, of course, it's hard to uh, breathe even for the normal person, right? Then, of course, there is a lot of drugs which are used, but of course, like that's not our topic right now. But of course, like many of the drugs can also be given for these patients. So uh, that's all for pulmonary rehabilitation. I will see you in the next lecture. Thank you.